Hi, my name is Dr. Eva Waller. I'm an assistant professor of anesthesiology and pediatrics at the University of North Carolina at Chapel Hill. I'm here with Dr. Sean McCullough, who is an inhalation toxicologist and affiliated faculty at the University of North Carolina at Chapel Hill, curriculum in toxicology and environmental medicine. And we are here to present the webinar, Making the Most of Masking. Let's focus on FIT. So conflict of interest and disclaimers. We have no conflicts of interest. The webinar team does not have any relationships or financial interests with or in any manufacturers or vendors mentioned in this presentation. And the information presented here does not necessarily reflect the views or policies of the University of North Carolina at Chapel Hill and/or UNC hospitals. Mention of trade names or commercial products does not constitute endorsement or recommendation for use. I would like to take a moment to thank our webinar development team shown here. I would also like to thank our mask photo volunteers listed in the bottom right-hand corner. We could not have developed this webinar without their help. So why are we talking about masks? We're talking about masks because respiratory infections are transmitted primarily through droplets and aerosols. Examples of different respiratory infections that are transmitted this way are COVID-19, but also RSV, flu, parainfluenza, and the common cold. Droplets and aerosols are not just released when you're coughing and sneezing. They are also released when you're talking, shouting, and singing. They are released through both the mouth and the nose. Face masks are part of a layered approach to prevention, as shown in this figure on the right. This is a Swiss cheese model regarding a layered approach to prevention. Each layer or intervention has imperfections, holes. Multiple layers improve success. Masks are a critical intervention in this layered approach. So regarding COVID-19 and the new Delta variant, transmission occurs through respiratory droplets and aerosols. Why are we concerned about the Delta variant? Well, it's more contagious than the original strain that causes COVID-19, and up to 1,000 times more virus is produced. It is more likely to result in hospitalization, and we're seeing more effects in children. Vaccination is vital in preventing hospitalizations, severe infections, and deaths, and is the best intervention we currently have against COVID-19, including the Delta variant. However, vaccinated individuals can still get infected and transmit the virus to others. These are called breakthrough infections, and while they occur at a lower rate than infections in unvaccinated individuals, they can still influence the spread of COVID-19. This is because vaccinated individuals with breakthrough infections have the same amount of virus in their respiratory tracts as unvaccinated individuals for about the first week of infection. So what are droplets and aerosols, and why do we care? It is now known that COVID-19 spreads via droplets and aerosols. Droplets, represented by the larger red dots, are large and settle quickly. They travel a much shorter distance in the air. Social distancing can work well against droplet transmission. Conversely, aerosols are much smaller and can remain airborne for a longer period of time and travel long distances. Aerosols are represented by the smaller black and orange dots in the figure. Social distancing is less effective at preventing aerosol transmission. Looking at respiratory aerosols, let's compare it to someone smoking in a closed room. How far away can you be and still smell the smoke? And how long does the room smell like smoke even after the person who is smoking has left the room? This is an example of an aerosol. It can stay in the air for hours, travel greater distances, and removal requires greater filtration. This means that mask function is even more important. So reducing transmission of COVID-19 and other respiratory infections, masks can be a prime intervention in reducing the transmission of these infections. Masks work in two ways. They reduce the release of germs from those that are infected, and they reduce exposure of healthy people to those germs. Both mask material and fit affect the function of the mask. Now I'm going to turn it over to Dr. McCullough, who's going to talk more about how masks fit can improve comfort and function.
Okay, as my colleague Dr. Waller said, both mask material and fit are important to maximizing face mask function. So let's start talking about material. Mask material does make a difference. Non-woven materials are much better filters than cloth, and non-woven materials are used to make surgical masks and N95 respirators. In contrast, cloth and woven or knitted materials can be porous, as you can see here. If you take this particular mask and give it a little bit of a stretch, looking at a light, you can see the light coming straight through the holes in the weave. So what are the important points to focus on for mask fit? The key areas for good fit are around your nose, your cheeks, and your chin. And basically, the better that the mask is going to fit on your face, the better it's going to work. It's also going to make it more comfortable, it's going to be easier to talk, and it's going to reduce the amount of fogging that you get on your glasses if, like me, you wear glasses. And it's important to pay attention to the fact that different people obviously have different faces, and different approaches and different mask sizes are going to fit different people differently. So thinking about a disposable procedure or surgical mask, it's important to make sure that when you take it out of the box, you don't just put it straight on your face. As we can see in the top row of photos here, you have a lot of gaps as shown in the red arrows on the cheeks and adjacent to the nose. But if you open the furls on the mask and you pinch the nose wire around your nose, those gaps are reduced around the cheeks. You have a nice fit around the chin, and then you get a nice contoured fit along the bridge of the nose. And speaking about the nose, it's important to make sure that your mask is always covering your nose. Remember, when you're at rest, most of your breathing is done through your nose, and virus levels are very high in the nasal cavity, and this can also be a primary site for infection. So make sure you get it covered up with your mask. It's also important to realize that one size doesn't fit all with surgical masks or just masks in general. And in this case, bigger isn't necessarily better. If you have a mask that's too big, as you can see in the first column here, you have these loop outs in the corners that lead to big open pockets on the cheeks, which is not going to do a very good job of either filtering air you're breathing in or preventing the aerosols that you're breathing out from interacting with everybody around you. And so in this case, we see a large mask, a medium mask, and a small mask, which in this case was labeled as a kid's mask. But realize that just because it says kids doesn't mean that it won't also fit adults that have smaller or narrower faces. And on this bottom row, you can see the difference in the fit at the cheeks, around the chin, and the nose fit is similar in these masks because you can sort of form it down with the nose wire. But it's really important to see this different in the cheek fit because you've got a lot of air that can come in and out of this cheek fold if it doesn't fit properly. One of the things that you can easily do to increase the comfort and the fit of a mask is to use something like an adjustable ear saver. And so in this case, the black mask shown here has a lack of fit around the cheek. And when we apply this adjustable ear saver to the mask, not only do we reduce the pull on the back of the ears in an adjustable tension way, but we can also then get an increased fit at the cheek. And remember, fit is related to function. There are also non-adjustable ear savers that can accomplish the same thing. And so you can see the non-adjustable ear saver back here where the mask just hooks onto these little different sized hooks in the back. And it's going to, again, pull the mask towards the face. It takes the pressure off of the ears, and it's going to close gaps that would otherwise be present in a larger surgical mask. It's also going to make sure that you get a good solid fit around the bridge of the nose and that that fit is maintained over motion and time. And even though cloth masks don't filter as well as non-woven materials, it's important to know how to make those fit better too. And so this is an off-the-rack cloth mask that is clearly too big for this volunteer. As you can see, it's sort of drooping below the ear here. You've got big gaps around the bridge of the nose here. And actually, during the course of taking these photographs and just discussing the photographs, the mask worked its way down this volunteer's nose, making these even larger gaps around the nose here. So if we apply an ear saver to this, again, we're going to pull that mask strap back. We're going to increase the fit by covering the cheek, making sure we have a nice tight fit at the bridge of the nose, and then ensuring good contact with the chin to get a better seal. One thing that can also be done to modify a mask to improve fit and comfort is the addition of a rigid nose wire. And so this is an out-of-the-box procedure mask that has a relatively flimsy nose wire. If you add this, which has an adhesive backing on the other side to the mask before you form it to your nose, it makes a much more rigid formation around the bridge of your nose, which means it's going to stay put much better, maintain its shape. It's going to reduce the amount of air that's coming out around your nose and reduce fogging of your glasses, and overall going to improve fit and comfort. One other thing that's been talked about a lot is double masking. And so it's important to note, if you choose to double mask, you always put a procedure mask as the first layer with the cloth mask over top, not the other way around. So in these pictures, what you see is a procedure mask that's a little bit too big for the volunteer that leads to some gap around the cheek, which, as we just talked about, leads to a poor fit. This particular cloth mask has a nice flap on the cheek. So when you combine these, in this case, with an adjustable ear saver, you get a compression of that cheek fit and an improved overall fit of the mask. It also helps maintain constant contact of the nose wire with the bridge of the nose, thus increasing comfort, reducing any fogging of glasses should you be wearing them, and overall increasing mask function. So now that you know some ways to increase the function and comfort of your mask, let's talk about how do you make sure that it fits. So when you put a mask on your face, the first thing you want to do is unfurl it if it's a surgical mask, and then you can take the nose wire, apply it to the middle of your nose bridge, push it down, typically with 2 fingers to get a nice fold around the bridge of the nose, and then you can put your ear loop straps on. At that time, you can put your hands on your cheeks and breathe out and see how much hot air you feel coming out on your cheeks. Same thing on your chin. I also find that it's helpful to use just a handheld mirror, and you can look in a wall-mounted mirror to check the fit around your cheeks. It also helps you look at the fit around the bridge of your nose. So it's also important to realize that the use of disposable masks doesn't end with us. When we throw these away, they end up in the environment. And so one very easy thing that you can do is to just cut the ear loops before you throw your mask away, and it will reduce the negative impact that these masks can have on wildlife when they're thrown away with waste. So a quick checklist for finding the best mask and the best fit. Make sure you're choosing a mask that fits your face. Again, focus on the nose, the cheeks, and the chin. Ideally, you want a 3-layered non-woven material. So this is a surgical or a procedural mask. If you use a cloth mask, make sure to give it that little pull in front of a light and make sure you can't see light clearly through the material. You want a strong but flexible nose wire to make sure that you can get a good fit around your nose that's going to stay put during the day. And you also want sturdy ear loops because that's going to give you extra tension on the mask and it's going to be a little bit more comfortable in the back of your ears. Also remember that you can use mask modifiers to improve fit and comfort, such as adjustable or non-adjustable ear savers and additional nose wires. And these things are readily available through many providers and things like Amazon. Make sure to check your fit, so you're getting a good fit on your mask. And then don't let the great be the enemy of the good. Some mask is better than no mask. And a mask covering your nose is better than a mask under your nose. So even if you can't achieve the best fit in a pinch, something is better than nothing. We have a couple of additional resources listed here, and I'd also like to point to some scientific publications that address the effectiveness of mask fit on mask performance.